Hi, welcome to Eating Challenges. This presentation is brought to you by NeoKids, and today I'll be presenting. My name is Laura Buick, a registered dietitian at HSN. I will also be joined by Shannon Gucci, who is an occupational therapist. This presentation is also put together with the Children and Community Resources. We also have Ali Millward joining us, who is a behavior therapist with the Children and Community Resources. So when we look at feeding problems, we're looking at 25 to 45% of typically developing children having some form of mealtime problem. When we look at children with autism, that incidence is going up to 90% to have some sort of food selectivity or mealtime behavior. You will hear us mention autism quite a bit in this program, as this was originally developed for children with autism, but we just wanted to let you know that we have identified that all of these strategies will work for children whether they have autism or not. So even though you will see those references throughout the program, please know that this is not specific to children with autism. So what we're really hoping to get at today is to help you guys all identify when feeding is a problem, to identify how feeding problems develop in our kiddos, identifying how feeding difficulties are assessed, and looking for strategies in terms of interventions. And then we are hoping that everyone will leave today with a goal for their kid that they can work on, that we will be supporting you with throughout the month. So first of all, we want to start with goal setting because we want to make sure that everyone kind of leaves this presentation with a goal. So why is it important? We need to have something to work for. So when we're looking at, thinking, why did you join us today? I want you to kind of think of what is the general goal for your child. We're going to look at kind of developing that goal throughout the presentation so that you will have something to kind of work on. When you're looking at goals, there really isn't a right or wrong answer, but we want to make sure that you guys can make your goals a little bit more specific as we go. So when we look at making goals specific, we're looking at making sure that they are SMART goals. So SMART basically is going to stand for specific, measurable, achievable, realistic, and timely. For the sake of our presentation, we do have a time frame in which we are going to kind of follow up with you guys. But all of those other parts, we want to make sure that you're kind of considering them. So here's an example of a SMART goal. And this family kind of came to us looking to kind of expand the amount of vegetables that this kiddo was going to eat. So the goal for this kiddo was going to have one bite of a non-preferred vegetable. And this was a goal that was going to be done with mom and dad. In terms of tracking, so making sure it's measurable, you can see that they were gonna kind of use their smartphone as a quick way to track whether the kid took the bite or didn't take the bite. And you're gonna learn about a lot of strategies throughout this presentation, so you can kind of see that there is a little strategy that we will talk about that includes flavor masking, which is when we're gonna use a dip or a sauce or something to kind of disguise the taste. And this family did think it would be a difficult task, but would be a realistic task. And you can kind of see that the time frame is about a month, which is generally the time frame we give you guys to work on your goals. So monitoring is the other part that's really important when we're making a goal. We want to make sure that what we're working on is actually being effective. Like anyone, kids have good days and bad days, and we want to make sure that we're looking at change over time and not necessarily judging on those good days or bad days. So here's a really nice example of a chart that was collected by one of our families. So you can kind of see that if you look at their goal, and I think their goal was to sort of increase the intake of protein and carbs in general, you can see that they did collect some really good data and it was put on this graph. But if you can kind of see on June 9th there, the intake of both foods was very, very low. So if that family came in to see us on June 10th, that very next day, they'd be like, oh my God, this is just a horrible intervention. It's not working at all. I don't know why we're even doing this. But if that family was kind of sick that day and they had to reschedule their appointment and then they came to see you, say on June 11th, you can kind of see that on June 10th, they had like the best day ever. So if they came in that day, they'd be like, oh my God, this is awesome. This is working. I can't believe we didn't do this, a long, long time ago. So you can kind of see how that good day and that bad day would kind of skew the data. But if you kind of look at this trend over time, you can see on average, the amount of food the child has eaten has trended up. So that's why this data will be really, really helpful in terms of, deciding whether this intervention is a good one or we have to look at something else. Here's another good way to look at collecting data, so kind of an easy chart. So you can kind of see that the crosses are days when they didn't try that food. So you can kind of see they've got different foods on there, the broccoli and the carrots. And then you can see the smiley faces are days when they chose to try those vegetables. So you can kind of see, if you look at week 1, there's a lot of X's, but then if you look kind of down to the end of the month, you can see we've got a lot more smiley faces. So we're definitely seeing that this intervention might be a successful one, because we're seeing it trend towards having more good days than bad days in terms of taking bites. So let's now look at when feeding is a problem. So when we look at feeding, we kind of look at it in terms of a continuum. So if we start on one end, we're looking at kids who tend to be overeaters. So these are kids who have large, sort of abnormally large intakes. They generally don't tend to be satisfied, ask for food quite a bit. Kids who are diagnosed with Prader-Willi syndrome could fall into this category of overeaters. Then we kind of move along our spectrum, and these would be normal eaters. If your kid was a normal eater, you're probably not at this workshop. They eat a variety of different foods. They're generally healthy, they're growing, there's not really many concerns from families. Then we kind of keep moving along, and these are the kids that we kind of start to see in terms of looking at picky eating. They might eat some fruits and some vegetables, but maybe they only eat 2 different fruits and 1 vegetable. They're a lot less likely to have any sort of medical issues, though, that are interfering with their eating. And picky eating might have stemmed from sort of looking for attention or trying to get a little bit of control over things. If we kind of continue along, these are our sort of more problem or selective eating kiddos. They will accept foods, but maybe they'll only eat grain foods and dairy. And maybe they eat 0 fruits or 0 vegetables. These are kids who are a lot more likely to have had or do have a medical condition that is associated with their problem eating. And when we look at these kids, their reactions to food tends to be big. So it's not kind of the kind of typical, "Mom, I don't want to eat this." It's more like the kicking and the screaming and the storming out of the room because that food is really aversive to them. And then we can kind of go all the way to the other end of the spectrum, and this would be where we look at something that would be called avoidant restrictive food intake disorder. And this end of the spectrum is actually physician-diagnosed eating disorder. So you would have to kind of visit your doctor to get this diagnosis. But these kids generally are a lot more, we would say, clinically not meeting their needs. Generally, these kids would require nutrition support, either through oral supplements or vitamins or minerals, because they generally would have deficiencies. In terms of sort of kids who end up on this spectrum, sometimes it can be brought on by things like anxiety, other sort of medical concerns that have kind of led them to this disorder.
Hi, I'm Shannon Gucci, and I'm an occupational therapist at the Children's Treatment Center. I'm just going to carry on from what Laura was speaking of in terms of the continuum of feeding difficulties. We're going to start to look at exactly how feeding difficulties develop. And one of the main things is obviously insufficient food intake, which Laura spoke of. Traditionally, we are used to kids that just aren't taking enough quantity of food in. So they're actually getting an inadequate caloric intake. But we actually see a lot of kids that have a high caloric or a low nutrient diet. Those are the kids that eat a lot of grains, carbohydrates. That's really their focus. And those are kids that, again, we will see in our clinic, and they definitely are at risk of feeding concerns. And finally, inadequate vitamin and mineral intake. So kids that have very small preferences, only a few foods, they just aren't taking in the range to get sufficient vitamins and minerals. So just to continue on about how feeding problems develop, in addition to the fact that kids might not be taking in enough calories or taking in calories that are just too high, when we actually see when feeding difficulties arise, it's often at times of transition. So we might see it when a baby is transitioning from breast to bottle, or from bottle to purees, or then even to self-feeding. Often this is simultaneous with children that have autism. When symptoms of ASD arise around 18 months, that's when parents also talk about difficulties with feeding, because that's a time of transition, often that transition to table foods. So another area that can cause feeding difficulties if a child has skill deficits. So in this slide, you can see a variety of pictures. For the first little guy, he is having actually difficulties with his oral motor skills. So in terms of his chewing, his swallowing. The next little person is having some difficulty with self-feeding. So that's another skill deficit that can result in feeding difficulties. They might not be able to hold a spoon properly, hold a cup, drink or eat independently. So also sitting posture or just their physical strength can affect eating. Because again, when we're eating, typically we're sitting down, we want to be well positioned. And finally, if there's any difficulties with attention, communication, that can also manifest itself in feeding difficulties. Another area that we notice that there's significant feeding aversions that can develop is when children have sensory difficulties. This can come in a number of different forms. One is food type selectivity. So it could be that they only like purees, they only like crunchy foods. It could even be a brand selectivity. They'll eat only Jane's chicken nuggets or McDonald's chicken nuggets. There could be environmental selectivity, and those are the kids that we see, well, my child will eat that at daycare or at grandma's. Why won't they eat it at home? There could be aversion to certain touches so that they don't like their hands or their face to get dirty. And there can also be poor recognition of hunger cues. So where they might eat throughout the day, we call that grazing. So they never really get a sense of feeling hungry or feeling full. We've attached a link, and this is actually a blogger who blogs about her daughter that has autism. Her name is Naomi, and Naomi discusses what her issues are with feeding. And so the excerpt is titled, "The Reasons I Don't Like to Eat." So Naomi goes on to say, sometimes people even want me to change rooms to eat. School does that. Why? I'm comfortable and happy, and then they make me move. And my brain is thinking about where I'm going. Did I leave anything I might need? What if things have changed when I get back? What if someone touches something? Those things scare me. So she's demonstrating environmental selectivity here. Then she goes on to say, you want me to move to someplace, sit down and eat, but I didn't ask for it. No one told me I would smell different things, hear different things. So again, there's sensitivity to sounds, smells, anything in her environment. She says, why do people eat funny things? People eat things with bright colors, and I can't understand that. My body is a pinky beige color, and that is a safe color. So again, a visual sensitivity. She says, some days I eat what you tell me is the same, and it isn't the same. It's not the way I saw it the time that I liked it. It does not have the same softness. I get upset, you ruined it. So again, the fact that Naomi really likes uniformity with her food. And then finally, texture sensitivity. She says, I like soft. When I chew sometimes, I get a little tiny bit to swallow, but then sometimes a bigger bit. That means it tastes different and it doesn't make sense. My teeth don't want to touch stuff because then it tastes like teeth, not what it should taste like. In order to demonstrate some of the things that Naomi talks about, whenever we're giving this presentation live, I will offer the audience a cup of tea. And often in our audience, we have definitely tea drinkers. So again, they're expecting a cup of tea. But then when I pour it, it's not what they expect. So I think it's just a good illustration of the fact that when we're presenting chicken nuggets or chicken breast or macaroni and cheese to our children, and we're curious about why they're not eating it, we have to think about, does it look exactly the way that I presented it before? Is there anything different about it? So just to summarize, insufficient food intake, skill deficits, and sensory issues can all lead to feeding difficulties and therefore disruptive behavior. And we see that in many of our children whenever it comes to eating, that they might not be able to communicate, they might not be able to identify what's happening, but we see them crying, spitting their food, throwing their plate across the room.
So I'm Allie, I'm a behavior therapist with Child and Community Resources. And in the next section, we're going to talk a little bit more about how feeding problems develop and the assessment that goes into that. The purpose of this section is just to give a little bit of perspective around a different lens that you might view the feeding challenges that you're experiencing in your family right now, because our guess is that you're probably very frustrated. You're seeing this as very disruptive to your family. And with that perspective, it's hard to have a lot of hope that this might change and get better. So our intention now is to just give you a little bit of more information about the rationale behind why these feeding problems develop and the history behind this. So the first thing that any of our disciplines would look at would be a medical history. And so we would want to know, have there been any painful experiences up until this point? Things like intubation, acid reflux, that sort of thing. If eating is a painful experience for a child, it makes sense that this is something that they wouldn't be interested in or that would be really hard for them. Likewise with oral motor difficulties, if chewing, swallowing, if those are really effortful things for this child to engage in, then they might avoid foods that are more difficult for them to chew or swallow, and they might stick to foods that are easier for them to navigate. In terms of a learning history, we would want to know, what has the child learned around eating in their family? Do they have a lack of prerequisite skills for eating? And Shannon will get much more in depth in terms of the prerequisite skills for eating. However, if the expectation is that your child sit for a 20-minute meal and in any other environment they are only able to sit for 30 seconds, then sitting down for mealtime will be challenging for them. Again, when it comes to setting a goal with this presentation, we want you to think about your family routine and the culture in your family. And if you are a family that is busy with extracurricular activities, then family routine might look a little bit different for you. And so you might not set a goal around sitting down for a family meal time every single night. Maybe your goal might be targeted more towards increasing the variety of foods that your child eats. In terms of reactions to eating food, this is something that I've experienced with my niece. And so she really, really liked tomatoes, and I really didn't like tomatoes. And so when we would eat a meal together, I would have quite animated reactions to tomatoes on my plate, and my brother would get really frustrated with me because he would say, your reaction to these foods influences her preference for them, when really she did like them. So we have to think about and reflect on the reactions. Maybe it's not that the child doesn't like the food, but it's our reaction to the food. And if we're a person that they trust and that they look up to, then perhaps our reaction might be influencing whether or not they like that food. When it comes to limited exposure to different textures, this is something that's so common, especially when there is fear involved in an experience. So for example, if you were introducing solids to your child and they choked or gagged on a food, it makes a lot of sense that you might be more hesitant to serve that food in the future, and so they might not have as much exposure with different textures of foods. Likewise with choking or gagging, if your child has had a scary experience with that, you might not be so forthcoming with serving those foods because of that really scary experience that you've had. When it comes to emotional and psychological history, just like any of us have preferences or aversions to certain types of foods, so do children. There's certain foods that they just like and don't like depending on the child. When it comes to fear or anxiety around trying something new, if we take the perspective of perhaps going to a country that we've never been to before and there's something on the menu that we haven't eaten before or seen even, we might be a little bit more reluctant to try that food. And so same with children, when they're introduced to a new food, they just might not be as brave to try it as some other children. When it comes to sensory processing, again, this is something that Shannon will touch on much more in depth, but food is a very sensory experience. There's lots of different tastes and textures and appearances that children are exposed to. And so if the sensory piece is overwhelming for them, there might be certain foods that they would tend to eat versus not. In terms of environmental effects, this is something that plays a huge role in feeding challenges. And so mealtime is a very social experience. There's lots of dialogue happening, conversation, sounds. And so if a child is, has skill deficits in social realms, then it makes sense that mealtime would be a really difficult time for them if they're having to focus all of their effort and energy on navigating a social interaction. Then food and eating might not be a priority for them in that moment. Mealtimes are also unpredictable. We never, as a child, you're never quite sure what's going to be served, how it's going to look, what it's going to taste like. And so there might be children that just might prefer not to take part in events or activities that are unpredictable, like mealtime. And then events that precede or follow mealtimes is hugely impactful when it comes to feeding problems. And so we like to use the example of a young man who loved yogurt. He would eat yogurt several times a day. And it just so happened one day that as he was taking a spoonful of yogurt, the fire bell alarm went off. And so this was a really frightening and aversive experience for him. And unfortunately, he paired that loud, awful, terrible sound with the spoonful of yogurt. And it was really difficult for him to introduce that food back. If we think of ourselves and any time we've had food poisoning in the past, there's probably a good chance that we take a long time, if ever, to eat that food again if we were quite ill afterwards. So to summarize, feeding challenges are so complex. They're very seldom straightforward with just one simple fix that needs to be made. So we hope that you'll consider that there might be components of each of those 5 domains that might be contributing to the feeding challenges that your child's experiencing. So we hope that there might be a strategy or 2 that you'll find in the coming slides that might click with your child and might support them and make an impact to the feeding challenges that they're experiencing. So who do we turn to for help? This chart gives an example of the different goals that you might set for your child and for your family, and then who the support team is that might be best suited to support. And as we mentioned, feeding is complex, and so a multidisciplinary approach is highly effective, but there might be certain goals that might be more suited to one specialty over the other. So if it comes to just improving the general nutrient balance for your child, you might connect directly with a registered dietitian. If it comes to developing and strengthening oral motor control, that's where an occupational therapist and speech language pathologist team might be really effective. Sensory strategies, that's where an occupational therapist can be really supportive. Also, when it comes to fine motor control, holding utensils, that sort of thing. Communication, being able to communicate what we like, what we don't like when it comes to food, when we're hungry, that's where a speech pathologist or a behavior therapist could be really effective. And then when it comes to increasing the variety of foods, that's where we see a really great approach to a multidisciplinary team supporting that goal, where an occupational therapist and speech language pathologist might be able to support in terms of the sensory strategies to exposing a child to new flavors or textures. When it comes to the behavior therapist, they might support with the teaching component of the skill deficit. And then dietitian would sort of guide in terms of where the most, where the important nutrients might lie or where they might be missing. And then in terms of mealtime compliance, that's where a behavior therapist can be really effective to support those disruptive mealtime behaviors.
Looking at assessment in terms of sort of the occupational therapist, the speech pathologist, the dietitian, the first thing we're going to look at is sort of any medical concerns. As a dietitian, I look quite a bit at growth and of course looking at the adequacy of what your child is taking in. And then we also kind of look at whether there are any sort of, again, like Shannon mentioned, sort of oral motor or physical concerns in terms of how they're taking their food in. So from a medical realm, it's really, really important that we kind of look at some of these things first, as if we do have some of these medical concerns, it's very hard to make progress in terms of feeding if some of these things are still an issue. So anything in terms of our gastrointestinal system, so in terms of constipation, diarrhea, if your child has pain or discomfort, they're really not going to want to eat. So we want to have a look at that, sending them back to the doctor if that's important. If kids have allergies or an intolerance that we're not quite sure what it is yet, sometimes, they are not able to properly necessarily communicate that that food causes their throat to itch or things like that, so they might just avoid it altogether. Of course, any time we have chewing or swallowing problems, we want to make sure that that's addressed. And anything like reflux. So if you've got that pain or burning in your throat, that can cause a lot of problems, and you're not going to want to eat, especially if it's a food that that child has identified that is kind of linked to those problems. Growth, again, like I said, is something that the doctors will really pay attention to. It's also something that, as a dietitian, we pay quite a bit of attention to. So we look at the children in terms of their weight, in terms of their height, and as well in terms of proportion. So we will look at what we call the body mass index, or when they're under the age of 2, we'll look at what is called weight for height together. We want to make sure that these kids are sort of following along a curve. So just to kind of, you can kind of see the growth chart that we've got here. A lot of parents will come and say, oh, my kid has to grow right in the middle. That's really important. Well, that's not really the case. We want to see your kid following their curve. So for this little kiddo, you can kind of see that I believe it looks like they're about at the 75th percentile when they were little. And you can see for the top part, which is their height, and the bottom part, which is their weight, they start to drop down a little bit closer to that 25th percentile and below. So you can kind of see that this kid might be a little bit of a concern because their growth curve has gone down. Another example is this little kiddo, and this is a BMI part, so looking at their proportion, their weight and height together, and you can kind of see that this little kid bounces up and down between the 3rd and the 10th percentile. So for this kid, I wouldn't necessarily be concerned, even though they're at the lower end of the growth chart, because they're generally kind of, we put a line through the middle, they're kind of averaging kind of along their typical growth curve. When we look at sort of nutrition in particular, the dietitians especially are looking for deficiencies. So we're assessing their energy intake, we're looking at their protein intake, we're looking at all of their vitamins and minerals and the fluids that they're taking in. So when we kind of meet with you guys and chat with you guys, we'll kind of look at sort of the adequacy of their diet in general. And we kind of compare it to the Canada's Food Guide for that quick reference. So for an example, if your kiddo doesn't eat anything on that fruit and vegetable side of the plate, that's going to kind of spark some red flags that we might have some nutrient concerns that we need to look at a little bit more detail. The same if you're missing an entire, all of the protein foods, or your kid doesn't eat meat. Those are kind of key red flags that, generally looking at the Canada's Food Guide, we can identify. So that plate picture that you saw, I'm sure that when you're looking at it going, oh my God, that is nowhere near where my kid will ever eat. We're never going to get there. So yes, that picture is a bit overwhelming. But just kind of knowing that that is sort of, a direction that we're going to get your kid to kind of eat that balance, and not necessarily that your kid has to eat all of those different foods that are on that Canada's Food Guide plate. So a fun little would you rather. So iron is often one of those nutrients that can be a little bit of a concern, but you can kind of see from this example that we can get iron from lots of different foods. So would your child rather have 55 goldfish or 4 tablespoons of hummus? Both will provide a pretty equivalent amount of iron. If we kind of carry on with that iron theme, would you rather, these are some even higher iron foods. So you can kind of see that, even if your kiddo doesn't really eat very well, they are going to get some iron from things like Fruit Loops, fortified cereals, things like that. You're even going to get some fortified iron in terms of a cinnamon sugar Pop-Tart that is fairly equivalent to having, a 2-ounce amount of meat, which for a lot of kids might be really overwhelming. So you can kind of see that even though your kid might not eat a really good variety of food, it is possible that they actually are eating their, getting their requirements of some of the nutrients that they need. If you look at sort of the average American diet, I do like a lot of different foods, but if I kind of think about my week, I probably do eat only an average about 30 different foods. So even though your kid might not eat that big variety, if they are eating on average 20 to 30 foods like the rest of us, they might be doing fairly well in terms of their nutrient intake. But sometimes we are worried, and we can do those more detailed analysis. So that's usually where you come and see us. You can do it on your own, but it can be a little bit time consuming. Basically what we're doing is getting sort of more in detail food intake records and trying to figure out whether there is a potential for deficiencies or excesses. So when we use that word potential, it's because even though your kiddo might not be eating super well, inside their body they might be doing okay. So their body stores are adequate. So sometimes we do have to look more medical to kind of see if there really are problems in terms of things like blood work and visiting the physician to kind of review that piece of the puzzle. So here's a little bit of an example of an in-depth, detailed analysis. I'm not going to kind of talk about it too much, but these are the kinds of things that we can look at in terms of, is your child at risk for things like low vitamin D? Maybe we do want to look at a vitamin for them. When we look at nutrients that are often concerns, things that we typically do see, calcium and vitamin D are up on that list as well. Like we kind of did our would you rather, iron is often a nutrient of concern. Omega-3 fatty acids as well as potassium are sometimes foods that our kids are not getting enough of. So just to kind of have a little bit of a glance at some of the different food sources of some of these nutrients, you can kind of see a nice little list of calcium-rich foods. If we kind of go to the next, we can see that some of our vitamin D sources. Vitamin D is also our sunshine vitamins. So even though you might not be getting enough from food, you might be getting enough from the outdoors. Though now with all of our hats and our sunscreen, it could still be a little bit of an issue. Again, when we look at iron, iron is one of those foods that is better absorbed when it comes from an animal-based product. So if your kiddo really isn't a meat eater or an animal product eater, they might be getting enough, but their body might not be absorbing it as well. So as you can see, there are some very good sources of iron, and your kid might be doing just fine without them. Other kids sometimes do need a little bit of a boost from a supplement if they're not able to get it through animal sources. And then a little bit of a look at omega-3s, and these are often found in our fish and our seafood, which, if I kind of look at a lot of different kids, that can be a little bit more of a difficult food to get. So sometimes we also do need to look at a supplement for them, but you can add things like ground flax and things like that might be able to get the omega-3s up a little bit. And then potassium, again, a lot of our potassium is found in our bright colors and our fruits and our vegetables. So if this is a bit of a challenge for your kiddos, you can kind of have a glance and see some other sources that you can kind of see if you can increase in their diet. So when we're looking at kids who are maybe not getting enough food throughout their day, sometimes we do have to put in some interventions. And so a lot of times when kids are underweight, we look at what we call calorie boosters, or adding certain foods into what they are eating to see if we can get their calories up. So those are often things like fats, so oils, butters, things like avocados, creams, peanut butters. So I find that cream is a really great one. If your kids eat cereal, things like that, you can mix it with the milk. If you're doing things, if they'll like noodles, things like that, we can add it in there and mix it in with their spaghetti, those sorts of things. And we also want to, when we're trying to kind of boost intake, trying to get those protein-rich snacks, seeing if we can add peanut butter into a muffin, those kinds of things. Sometimes we do need to kind of also go into supplements. So sometimes looking at things like Pediasure and other different brands of nutritional supplements. And then of course, sometimes we do have to look at vitamins. We definitely don't recommend individual vitamins without sort of a dietitian or a doctor recommendation, but oftentimes a multivite could be something that you can kind of add in on your own. And sometimes we do need to look at individual intake of different vitamins to up their content and making sure that they're getting what they need.
At the Children's Treatment Center, typically we do assessments with myself or another occupational therapist, but we also usually are doing joint assessments with a speech-language pathologist. Very much like Laura spoke of, we will look at medical history when it comes to doing feeding assessment, but we also look at a few other areas that are a bit more specialized to both OT and SLP. Things like oral motor skills, so an ability to chew and swallow. We look at overall development because physical development does impact feeding. We look at sensory skills, feeding independence, so an ability to self-feed, and we also look at language and communication. So in terms of looking at kind of a developmental approach when it comes to feeding, what I want to now talk about is to actually go over what skills are expected at what ages. And I really want to indicate here that although these are averages, every child is different. So if your child isn't eating a carrot at 18 months of age, it doesn't mean that there's an issue. There's definitely, as I said, a big range. When I go through kind of the food continuum or the skill development, what I'll often ask parents to do is to actually take, say, a mini marshmallow like this, to place it on your tongue and leave it there while I do the rest of this presentation. The reason is because I would like you to kind of see what your mouth is doing when you are presented with food. So typically, obviously, when a child is born and an infant, breastfed or bottle fed is the first type of feeding that occurs, and it usually goes until at least about 12 months of age. In there, we layer upon then feeding purees, which usually happens at about 6 months of age. So you can see on the chart that there's different oral motor skills that are required. So it ranges from sucking and then to where some tongue and some jaw movement are required for purees. Beyond that, then we move to soft mashed table food, which occurs around 7 to 8 months. And that's when there's actually some tongue lateralization. And what that means is that your tongue is actually moving from one side to another whenever you're having more thicker foods. Then we move to dissolvable hard solids. So those would be kind of like a cracker, Cheerios, things that tend to melt in your mouth. Which would be the example of the marshmallow if you're still having that in your mouth. That comes around 9 months of age. And often if the food is big enough, a child will take a bite of it kind of anteriorly and then move it back into their mouth for chewing or for munching. And that's the skill that's developed around 10 months with soft, solid finger foods. Then at about a year, then solids become mixed. So that's when, if you're looking at kind of a jarred baby food, when all of a sudden there's increased consistency, it might be cereal and milk, it might be soup that has a broth and a solid, it could be pasta, because then the child needs to be able to separate foods in their mouth. And then finally, as I said, about 18 months is when a child would be able to eat a hard solid. Again, no issue if they can't eat a carrot at that time. I don't know that I'd be giving my child a full carrot at 18 months of age. But it definitely developmentally, that's typically when a child develops the oral motor skill to have what's called a rotary chew. And what that looks like is the fact that the jaw is closed and then that the child is able to actually move their jaw around in a circular motion, not just up and down, which is often what we'll see with just munching at about the 10-month age. So if that marshmallow is still in your mouth, and I'm going to guess it's not by now because it's probably driving you crazy, I just want you to contemplate what you've done with that. Again, the movements that have happened in your mouth, that you might have moved it from one side to the other. Maybe you have munched on it. Maybe you've done a bit of a rotary chew. Maybe you've swallowed it. But just again, keep that in mind when you're presenting foods to your child. If developmentally they're not able to handle that food, what do they do with it? They might want to spit it out. They might be very uncomfortable with it. Now we're going to move on to the fact that eating is a sensory experience. Kay Toomey, who's a psychologist in the US, she actually broke down feeding into 22 steps. We often think of it just as put the food in your mouth, chew it, swallow, done. But think of it as a whole experience, that there's food in the room, there's food on my plate, I'm interacting with the food, I'm touching it, I'm smelling it. So there's all of those steps, and we have to keep that in mind, again, when we're presenting foods to our children. So it might not be that they don't want to just eat the food. It might be that they just don't want to tolerate it on their plate or in the room beside them. So we need to kind of take steps back sometimes when we are introducing foods to our children. Keeping in mind that, maybe we just need to start with them just interacting with the food on the table in front of them. In the presentation slide decks and the handouts that we'll be providing you, you will see that we will attach a food chaining form and a 2-day food diary. And we've got examples of that here on our slides. The food chaining form just does break foods down into kind of the traditional food groups, grains, meats, those type of things. And you're meant to check them off to try to have a bit of an inventory of what your kids are eating. It might not be just presently what they're eating, but also what have they eaten in the past? Because we'll often use that as a launching point to try to introduce new foods or reintroduce old foods, because we know developmentally they ate the food, they were capable of eating the food in the past. We might be able to reintroduce it at a later time. The daily intake log, or the diaries, both OTs, speech pathologists, and even our dietitians will use those records. And we've got a few examples from a few kids that we worked with. In the first example, you'll see that there really is kind of a tendency to eat a lot of grain products, a lot of like white, beigey type foods. We can kind of note that there's not a lot of milk products being eaten, maybe not a whole lot of meat, but we also look at behaviors when we look at these food diaries. So the fact that this child might have really preferred foods if there was grated cheese on top. And so we can use that as something we call kind of flavor masking, where we'll introduce foods with a preferred topping or a preferred sauce, and the child might be more amenable to eating. With the second example, you can see again that there's a tendency to eat again the white, beige type foods, but we see a few other behaviors. We see the fact that they use their finger to move that cucumber off the plate. They really don't like the touch of food. So again, we might look at, giving them utensils, giving them a cloth to wipe their hands. There's maybe again some gagging that's happening around mushy foods, soft foods. Again, keeping that in mind that maybe those aren't the best foods to be introducing. We notice that again there's some preferences for some sauces, mustards, jams, butters. So again, some potential to introduce food with those sauces. And then as well, a little bit of issue with grazing, where the child is not sitting for a long period of time. So again, recognizing that they might not have kind of big hunger cues or a sense of fullness if they are only eating, for a minute and then walking around. So again, things to keep in mind when we're wanting to maybe present foods and maybe having them presented at a table with an expectation of sitting down. So if we move to strategies, one of the ways that we would start sometimes is not necessarily with quantity, but we might look at quality. So we might look at introducing foods with preferred food consistencies. So like I said, if the child really prefers crunchy foods, you might want to stick to those kind of foods and then follow up with quantity after. Or again, if there's a preference with taste, you might want to start with the taste. If they really like bland foods, you want to stick to that before introducing something with lots of flavor. A way to introduce foods kind of in a step-by-step progression is something called food chaining. And we have an example here with a round orange Ritz cracker. If you want to move a child from, say, eating crackers all the way to eating bread, that's actually quite a few steps if we look at it. Ali will talk a little bit more about the steps of feeding in a few minutes. But in terms of food chaining this orange Ritz cracker, what you might want to do is you might want to move to a round whole wheat Ritz cracker first, then move to a square whole wheat cracker, different brand, then to actually a totally different brand of whole wheat cracker, then to a piece of toast using whole wheat bread. But what you might want to do is actually kind of squish the bread down, remove the crust, and cut it in the same size as a whole wheat cracker. So again, not to minimize the fact that, this is not 4 easy steps. This might take months to get there, but just keeping that in mind about how maybe if they're eating a cracker, I'm not going to move all the way to white bread. I'm going to try to break the steps down so that the child will be more accepting of the new food. So again, when we're looking at other sensory strategies, if the child has some sensitivities to touch, you might try to avoid that. So you might have them use utensils. You might have them have a wet cloth beside them so that they can wipe their hands. You might want to do some exposure when it comes to touch by having a therapy meal where they actually play with their food. Again, some parents aren't always comfortable with having kids play with food because they want them to eat the food. But we find that sometimes kids just want to play. So you're taking it back those steps that Kay Toomey talked about, where it's just interacting with food. No expectation to put it in their mouth, just to touch it, smell it, have it in front of them. Again, with sensory, you can break it back into the steps that Kay talked about, so that you might want to strategize that your goal is just that the food is in front of the child. That maybe the smell is, it's a food that doesn't have a lot of smell. You might then want to move to, okay, now the expectation is that you're going to touch the food. Then maybe you're going to put it towards your lips, you're going to take a kiss of the food, or maybe you're going to lick the food, or maybe you're going to put it in your mouth, but then you give them permission to spit it out. So again, working on sensory defensiveness with food in a stepwise manner. Keeping in mind that you can flavor mask food. Often, there's some schools that might say that you could trick your child into eating foods and hiding foods, but maybe just being more transparent that you're offering a food, but you're just putting a special sauce or a favorite margarine or something like that on the food so that they're more willing to try it. As well, you can also cut the food up very small. And often when we're talking to our parents, they say, oh, I already do that. I cut it up, this small. I would say even whatever you're cutting it up, think about cutting it up smaller. I'll often use the example of cutting it up like half of the size of your baby fingernail. That's how small it should be. Because often, again, when a child is looking at a food and you present it in that small of a manner, they think, hey, that's all she wants me to do? I can do that, no problem. As well as the fact that once they put it in their mouth, it's so small that chances are it's not going to spend a lot of time in their mouth. They can almost just swallow it. They don't have to chew it. They don't have to move it around with their tongue. They're not having to taste it as much. So again, kids are more willing to try that. That also helps with kids that have oral motor difficulties, because if you do cut it up very small and they have any kind of chewing problems, you really are making it easier for them. Or if you present the food in, say if it's steamed or it's cooked rather than presenting like a cold vegetable, again, it just makes it easier for the child if there's any sensory issues or if there's any chewing difficulties as well. Another strategy is that you can also give a drink after each mouthful of food, just to let them clear their mouth. Sometimes kids prefer that because, again, like Naomi at the beginning when I spoke of, the fact that she wants predictability with her eating, if they're putting pasta in their mouth and then they maybe have a vegetable too, it might just be too much for them. So if they take one food at a time, they swallow it, they take a drink, and then they're able to take another bite of food. But biggest message here is really respecting developmentally where your child is at. So even though your child might be 2 and you'd expect them to be able to eat hard solids, they might not be developmentally at that stage. So don't be providing them with a hard carrot or expecting them to eat that because they just developmentally are not at that stage. I also talked at the beginning just about kind of positioning and the importance of that. And you can see in this slide, this little boy is very well positioned. His ankles, his knees, and his hips are all at 90 degrees. And although probably Miss Manners would not approve of elbows on the table, he does have extra support by doing that. So again, think about that whenever your child is eating, that they are very well supported. If they are, they don't have to then worry about trying to balance their trunk while also trying to take a spoon and trying to eat. You're just taking one piece of the puzzle out of the way so that the child can focus on eating. Other strategies that we will use is often adaptive aids. And I've got a few examples of those. You can see them in the pictures and then I'll present them as well. In the pictures, you'll see an example of what we call as a scooper plate. You can also get that as a scooper bowl. If kids have any difficulty kind of scooping out their foods or balancing that, this raised edge really helps with that. In terms of cups, sometimes what we'll recommend is very small cups, so almost like a shot glass. Again, when a child sees something so small, they think, hey, I can do that if it's presenting a new liquid, as well as it's just a bit easier to hold for small hands. Sometimes we'll recommend things like a nosy cup, and that's where you can see part of it is cut out. And the reason for that is any child that might have difficulty with neck extension when they're swallowing, this eliminates that because they can just tip the cup back without having to move their neck. Other things that you can consider is just maybe having a placemat or something called Dyson that's very sticky that your plate will stick to. So again, that there's not a lot of movement of the plate, so the child doesn't have to worry about that. So you can look at using a smaller spoon. This is called a maroon spoon, but you really use any kind of infant spoon. The benefits are the fact that the bowl of the spoon, it's very small and it's very shallow. So it's very easy for a child to remove food from the bowl of the spoon. And it's also, again, small. So if a child just has, the expectation is just to take a small bite, this really is a small bite. If a child has difficulty holding a spoon or a fork, you might want to look at actually building it up, so making the handle a bit bigger so that it's easier to hold. And sometimes we'll even look at curved utensils. So this is a curved fork so that kids don't have to worry about kind of that wrist movement getting the utensil to their mouth. Another strategy that we found very effective sometimes is playing games around food. And you might not want to do this at mealtime, but you could do this at what we call a therapy meal, which might just be once a day, once every few days, not attached to a meal, but say in the afternoon or on the weekend. You can see by this, the slides, and unfortunately I don't have a dinner winner plate, but that's what we actually call this game and call this plate. But you'll see a number of different slots, and you'll see with the attached picture that there's also some food in the slots. The idea here is that you're going to place a preferred food, a non-preferred, preferred, and you keep going till the end. At the end, there's a little cover and there's a prize underneath. So you might want to put a piece of food that's a real favorite, a real treat. Sometimes parents will put a dollar store item, even a little map to a treasure that they might find after they play this game. The expectation is that they'll eat their preferred food, then they eat the non-preferred, but it's followed by a preferred food, so maybe it's not that bad. The other piece that's very important here is that you keep the pieces of non-preferred foods very small. In the example where you see the picture with the food that's already in there, that is way too big for a non-preferred food. Again, keeping in mind that size of your baby fingernail. So again, the children often will be willing to play this because it's a game, it's fun, and the pieces are so small and followed by preferred food and an eventual prize that they think that this is great. The expectation would then be that you might then be using the non-preferred food eventually as a preferred food in this game, or you're then moving the non-preferred food to a mealtime because, hey, you ate it during dinner winner, let's put it on your plate. Again, in a very small quantity. And then you can keep introducing new foods this way as the non-preferred, eventually hoping that it will be a preferred food. Again, some parents might play this game not just once, but twice or 3 times in an afternoon. Again, you'll want to always check with your child, make sure that it's a positive experience, and you want to end on success. So if they are really not willing to try the non-preferred food, what you might want to do is just say, okay, that's fine. How about you give it to me? And just that fact that they're picking up the food and they're giving it back to you, they're interacting with the food, they're touching the food. So it's been successful. So always back up the steps if you feel that they have not been successful at the step that you've presented. The dinner winner plates are available on Amazon and they have all different themes, dinosaurs, space, cars. So you can look at that if you're interested. Otherwise, you can always employ just a divided plate. Where you're still putting a preferred, non-preferred, preferred, and then you can have a prize kind of outside of the plate Finally, in terms of environmental strategies, you really want to keep in mind that a mealtime routine that's predictable can be very helpful for kids that have feeding difficulties. Because you're sitting as a family, you're doing modeling yourself, maybe the child's siblings, that can be very effective. You want to always offer foods repeatedly. Lots of our parents will say, I've offered it 5 times, 10 times. We'll often say you have to offer it 15, 20, 25 times before a child will recognize, it's not too bad, maybe I will eat it. You want to keep things also variable. You don't want to offer the same non-preferred food every day or every meal. You want to kind of switch it up. And you want to also give choices to your children. So if it is a non-preferred food, maybe give them that choice of what non-preferred food would you like on your plate, just so that they have that sense of control.
So now we're going to look a little bit from the behavioral lens of how we would assess and treat challenging feeding behaviors. So we would commonly ask these 5 questions. We'd want to know, what are we working toward? What's our end goal? What's our end game? Then we'd want to know what is currently getting in the way of this goal, and what are the challenging behaviors that are preventing this goal from being successful. We'd want to know, why is the child doing this? When it comes to behavior, our science focuses a lot on the why. Why is the child doing what they're doing? And we believe that there's always a reason, even if it's not very apparent, that there's always a reason that a child is doing something. So they're either trying to get something or get away from something. And we'll talk more about this in a few slides. Which skills need to be taught? And so perhaps there's a skill deficit and that we need to teach some replacement behaviors. Maybe the child doesn't know what to do, and so they're doing what they're most comfortable doing. And so we'll teach them some more appropriate behaviors, replacement behaviors, to get their needs met. And finally, how are we going to measure change? So again, we don't want to waste your time. Your time is precious, and we want to know that the changes that we're making are effective and efficient and meaningful for your family and for your child. So we want to make sure we're measuring change in some way. It doesn't have to be complex, but we do want to make sure that what we're doing is effective. So we're going to do a little crash course in behavior analysis and look a little bit more in depth about learning history and how some of the contexts and the environmental factors around eating play into feeding challenges. So when we're talking about learning history, and you'll see in these next few slides, we're going to talk about reinforcement and punishment. We want you to think about reinforcement as just meaning that something is more likely to happen again in the future. When you hear the words positive or negative, think elementary school math. So positive meaning we've added something, and negative meaning we're taking something away. So when it comes to positive reinforcement, I do something, I get something awesome, something is added. I'll probably do that again in the future. So that's that reinforcement piece. So the picture here is of a little baby crying. So I do something, I get something awesome, I get my bottle. I'll probably cry again in the future when I'm hungry because it got my needs met. The next slide, negative reinforcement. So this is something that is so powerful when it comes to feeding challenges for both the parent and the child. But essentially, again, when you're hearing the word negative in this context, we're thinking removing something. So there's something really awful happening. So I do something, that something awful gets removed or stops, and I'll probably do that again in the future, again, because there's that reinforcement piece. So an everyday example that you might encounter in your everyday life is the snooze button, right? The alarm goes off in the morning, you hit the snooze button, that awful sound stops. You're probably going to do that again to get a couple more minutes of sleep. And so when it comes to food, when I said that this is really powerful for both child and parent, it's because for the child, that aversive food, that plate of food that they don't like is presented, they start screaming, the plate of food gets removed. They'll probably do that again in the future. And so for parents, that screaming, again, that snooze button on the screaming, when we take away the plate, the screaming stops, we're probably going to take away the plate in the future, or maybe we don't even offer it. And so that's how negative reinforcement can play a really big role in learning history and why children might have certain behaviors around mealtime. So when it comes to punishment, again, we're not thinking of reprimands in this case. We're talking about something being less likely to happen again in the future. And so we do something, maybe we eat a certain food, something really unpleasant happens, and so we're less likely to do that again in the future. It's punished. So this picture here of this little boy on the left, he's eaten something, he's gotten sick, he's probably less likely to eat that food again in the future. And then as a parent, things, eating experiences, certain foods can be really punishing for ourselves as parents. And so we do something, we present this big plate of spaghetti dinner to our child, something unpleasant happens, there's a massive mess. And so we're probably less likely to present the big bowl of spaghetti in the future if it means we have to clean up a mess like that. So next we're going to talk about reinforcers, and we really want to distinguish between what your child likes versus what they'll work for. And so if we think of ourselves, if you're anything like me and you love coffee and you drink it every single day to the exclusion of water, you probably still wouldn't work 2 weeks to get a cup of coffee. You'll work for your paycheck, but you won't work for a cup of coffee, even if you really, really, really like it. So when it comes to our children, we need to think about what is reinforcing to them, what do they like, but what will they work for? And so on the next slide, you'll see this is a sample of a reinforcer survey, and so sometimes it helps. You can find these online. It helps to look at big inventories of different reinforcers potential. They could be food, movies, games, social interactions, but to look at them and to think, does my child like it a lot or not at all? And so using this chart, we might say if our goal was to get our child to tolerate a little small bite of broccoli, we probably wouldn't say, babe, if you eat this little teeny tiny bite of broccoli, you can have Baby Einstein after, because the child doesn't like Baby Einstein at all. They're not willing to work for Baby Einstein. But we might offer chips or TV or the truck, because those are highly preferred reinforcers. So just sometimes having an idea of what your child really likes versus what they'll work for can help to identify some of those things that we might use to encourage those new eating behaviors. So we spoke a little bit about baseline and data, and so these are some examples of questions that you might ask yourself when it comes to trying to identify how we're going to measure change and success. So we're going to look at both, the challenging behaviors and the replacement behaviors that we want to teach, and also those prerequisite skills. So what's required in order for the child to engage in some of those more appropriate behaviors that we want to see. So we might ask things like, with whom? So who do they currently eat foods with? Maybe your child eats yogurt at daycare, but they won't eat it at home. So maybe our baseline then says, child eats yogurt with daycare, and at the end of our intervention, if child is eating yogurt with mom and with dad, that's a measure of successful change, because now there are more people that your child will eat yogurt with. We might ask how much or how many. So when it comes to the variety of food that your child eats, we could look at how many foods are they currently eating before intervention and how many after, to see if we've got successful strategies in place. When it comes to how intense, that speaks to the intensity of the reaction. Maybe your child says, I don't like that, or I don't want that. Or maybe they have a massive meltdown where they're throwing things, they're running, they're screaming. There's a lot of intense behaviors happening. So that might be our measure of change. Maybe it's, sort of annoying when our child says that they don't want something, but maybe that is more successful and more appropriate in your family and in your home than a massive meltdown. Where will the child eat certain foods? Are there certain environments that they're more likely to eat foods or less likely? For how long? So this is maybe around sitting at the dinner table for mealtime. So how long are they currently able to sit? Maybe it's 20 seconds. And how long are they sitting after we've implemented some of the strategies that we've talked about today? How close or how far? So this is that ability to tolerate foods that maybe they don't like in close vicinity to them. So maybe we start with your child won't even tolerate the food that they don't like on their sister's plate across the table from them. And a measure of successful change would be after intervention, now they're tolerating it in front of them on their plate without those really challenging behaviors. There's still no expectation to eat it, but at least they're tolerating it on others' plates and on their own plate without having to eat it. So functional analysis, this is something that it sounds very technical, but it just helps us to understand how people interact with their environment. And so again, this is looking more specifically at what does a person get through their behaviors and what do they avoid with their behaviors. And in behavior analysis, that's oftentimes what we're looking at. What is someone getting out of something and what are they getting away from, and or what are they getting away from, depending on what they're doing. Big behaviors, big outbursts or meltdowns, that's a lot of energy expenditure. And so there's a reason that your child is doing what they're doing and they're communicating something. So we want to understand a little bit more around what they're communicating. Why is the behavior persisting? What is going on in the environment that is making this big, effortful energy expenditure so important and relevant for this child to either get something or get away from something? So when we talk about function or why, we look at the different reasons that, again, a child might use certain behaviors to communicate or to get something or to get away from something. And so this is just a funny little image of the 4 different functions, because traditionally we look at 4 reasons as to why someone might do something. And so when we talk about escape, that's getting away from something or avoiding something that's really aversive. And so for some children, this might look like leaving the dinner table, running away, throwing things off of their plates. That would be sort of that escape or refusal behaviors. Attention. So this is one where oftentimes, and understandably so, as parents, we want our children to eat and we get really anxious when they're not eating. And so sometimes a lot of that really high quality one-on-one attention, whether it's sort of that coaxing, reassuring, coaching from parent, or it's the sort of reprimands or frustration, or that regardless of whether you perceive it as like positive or negative attention, there's still a lot of one-on-one high quality engagement during that time. So you might look at, when is the majority of engagement happening with my child? Is it when they're sitting and eating appropriately, or is it when they're doing things that maybe they shouldn't be doing? And so that's where we might sort of look at the balance and say, maybe we need to redirect some of that engagement to when they are sitting and doing appropriate things, and maybe a little less engagement when they're, spitting or gagging or doing silly things with their utensils. When it comes to tangible, this is a big one, and like we said, you want your children to eat, and sometimes you'll do things like make a second or third meal. I know I do this for my little one, and so when it comes to tangible, this might mean that your child does something in order to get something else. So maybe they want a peanut butter sandwich. That's all they want to eat, and you present this lovely plate of salmon and broccoli and rice, and if they've learned that if they refuse long enough, if they throw the plate, if they gag, if they do something, they'll get the food or the dinner that they actually wanted. And so that those behaviors might be to get access to that second dinner that you're making. So when it comes to sensory, Shannon spoke a lot about this, but of course there's different textures, smells, tastes, different things that our senses experience when we're eating foods. And so certain children might have preferences for like hard and crunchy foods. And so they might do things to access those types of foods, and then they might avoid the slimy or slippery foods that they don't like from a sensory perspective. So now we're going to talk about replacement behaviors. So when we talk about replacement behaviors, we want to give your child different behaviors that they can engage in that will still get their needs met. So again, this is where we really want to understand, why are they doing what they're doing, so that we can teach them something else or sort of capitalize on that to help build a more appropriate replacement skill. So for example, your child might want a sandwich. You know that tangible function, they want the sandwich. You oftentimes make it for them anyways. So what do? Currently, right now, they're throwing their plate across the room. They know I throw my plate across the room and I get that sandwich. So what are some replacement behaviors that we could teach them so they still get access to the sandwich, but it's more appropriate than throwing the plate across the room? So maybe we teach them to ask for it. Instead of throwing their plate across the room, getting them access to the sandwich, them asking appropriately in whatever language is appropriate for them. Maybe it's one word, maybe it's several words, a sentence, maybe it's a picture exchange, whatever works for your child, but maybe we teach them to ask for it. Maybe we have them take a bite of stew. So sure, no problem, babe. You can have that sandwich, but you have to take a bite of this first. And again, you would reflect on some of the strategies that Shannon spoke to in terms of like the size of the new food that you would have them take a bite of. But maybe that's the expectation. Take a bite of stew, then you can have your sandwich. Maybe your goal is you want your child to sit for 5 minutes with your family. And so they can still get access to that sandwich, but first they have to sit for 5 minutes with the family. And that would be made clear to them ahead of time. Or maybe we teach them just to make it themselves. If developmentally you want them to build that independence and to increase their independence, maybe we teach them, hey, here's how you make a sandwich on your own. You can make it. And that might help to avoid some of those throwing behaviors if they know how to make it themselves. And in doing that, they're also touching and manipulating food and getting involved with food from that perspective. So we're going to start with our general goal that you wrote down at the beginning of the presentation. And now we're going to break it down into smaller steps. So keeping in mind that steps can be added, removed, changed, anything that you need depending on your child's progress. So say your goal is to have your child sit for longer times at mealtime. If your baseline, you're pulling out your timer and you're kind of taking some data on how long they're currently sitting at the table is only 30 seconds, then a next step is probably not going to be 15 minutes. That's too much of a jump. So maybe if they can tolerate 30 seconds, your goal or your next step is 40 seconds. So maybe they don't notice that 10-second difference. Then maybe it's a minute, that may be a minute and a half. And so keeping in mind that depending on your child's progress, maybe you remove steps because they did 1 minute, no problem. They're absolutely crushing this. So then we'll make the expectation a little bit bigger. Maybe they can't tolerate the minute. So now we're going to break it back down into like 30-second increments. So that's where you're going to want to be taking that data to see, do I need to add steps or remove steps? Where are we getting stuck or where's the breakdown happening? And then again, we're collecting data all the way to see, are our strategies working? Is this a waste of our time? Do we need to sort of change things up? While also accounting for those good and bad days. So keeping in mind that, one bad day doesn't necessarily discount the whole intervention and that maybe we need to give it a little bit more time. And then, of course, considering the why. So making sure that we've really understood why the child is doing what they're doing. Going back and revisiting those 4 functions of behavior to see why are they doing what they're doing so that I can give them some strategies that are still going to get their needs met. So now we'll get into some strategies of what we can do to help support or build those new skills. So one of the really common strategies that we use is a first then strategy. So what happens first is our expectation and then something that you want, your motivation, that gets to happen. And so this, again, it depends on your goal. So first you sit for 40 seconds and then you get your sandwich. First, you take 1 bite of broccoli and then you get your Smartie. So depending on what they're motivated for, what they're going to work for, you have your expectation first and then their reinforcement comes after. Sometimes we hear this sounds a lot like bribing, and the difference with a bribe versus a first then strategy is that this is set up clearly at, before mealtime even happens. The expectation is set, versus a bribe is something where we see it sort of be presented in the middle of a behavior. So for example, you go to the grocery store, you're walking down, the checkout aisle, your child starts tantruming because they want a chocolate bar, and you say, if you just stop, I will give you the chocolate bar. That would maybe fall more along the lines of a bribe because you're sort of pulling out this reinforcer in the middle of a challenging behavior. We don't want your child to think, I engage in a challenging behavior and then I get access to this thing I really want. Your expectation is what sets up that contingency. And so if you go into mealtime saying, first you sit for 30 seconds with us at the table and then you can leave, that expectation is clear from the outset before you even go into mealtime. So that's completely different than a bribe. And then remembering too that your then should be based on what the function of their behavior is. And so if they want to, if the function is to escape, to get away from the table, they just don't like being at the dinner table, then maybe that's the reinforcement. You sit for 30 seconds and then you get to leave. You tolerate your plate in front of you for 30 seconds and then it goes away, something like that. So here's a couple more examples of first then. And again, this would be completely dependent on your goal, your child, and what they're motivated for and what they're going to work for. This is an example of a contingency map. And so again, we've spoken a lot about how children, they need control over their lives. They need to feel that they have control. And so giving choice really gives them that sense of control. And so this is sort of like a choose your own adventure for your child. So you make it clear before you go. You could use a visual like this, or maybe it's pictures if your child doesn't read, but you sort of show them in this situation, if I choose to do X, this is what happens, but if I choose to do Y, then this happens. So for example, with children, you might say, if you eat your broccoli now, then you get to have your dessert. If you throw your plate across the room, then you don't get to have your dessert. So it's really clear from the beginning, before mealtime, what the expectation is. And if they choose to do that inappropriate behavior, they understand what the consequence of that will be. Likewise, if they choose to engage in that appropriate behavior, they understand what they're going to get out of it. So another strategy that we use commonly is called shaping. And so if you look at the before and after picture of this tree trunk that is turned into this beautiful sculpture, it didn't go, from before to after in just one step. There were multiple steps that were involved in sort of shaping this to be the end product. And so shaping as a strategy works much the same way, where we will slowly and gradually accept things that are closer and closer to our end goal. So that might look like a hot cold game where perhaps you hide a pea under a piece of bread on the plate and you say, oh, where's the pea? Find it. And you play hotter or colder so that they're kind of exploring around their plate to find the pea. We use the example of high jump because in high jump, the bar never gets lowered. And so you never want to go backwards in your expectations. So if your child was sitting for 30 seconds and now they're sitting for 40 seconds, we're going to expect 40 seconds from them every time. We're not going to go backwards and only expect 30 seconds because we see what they're capable of. So we want to keep going forward, progressing forward, and getting closer and closer into that end goal. And then also understanding that better responding gets bigger reinforcement. So maybe they went from 30 seconds to 1 minute, and that was a huge leap for them. That gets a big party, lots of reinforcement, more time on the iPad, whatever their reinforcer is, as opposed to those littler steps, maybe get just a little bit of reinforcement. The next strategy that we're going to talk about is chaining. And so chaining is really big when it comes to self-feeding. So for example, much like links on a chain, we can look at a task such as feeding yourself and break it into a multitude of steps where we're teaching each of the steps individually to the child and supporting them with the other ones. So for example, you can either go from the start of the chain or the end of the chain. And so if we look at the example of feeding self independently, maybe our expectation or our teaching is just picking up the spoon. So maybe that's the expectation, and then we support them with all of the rest of the steps. Or you could do the other direction. So maybe you help them with the first 4 steps and you support them with the first 4 steps, and then the teaching step is putting food into the mouth because that's somewhere where you've seen a little bit more success. So it's going to depend on your child, and you can go from the top of the chain to or the bottom of the chain, but just keeping in mind this idea of sort of helping them with the rest of the steps and then expecting a little bit more independence on either the first step or the last step. This is an example of how detailed a task analysis can be. And again, task analysis just means how do we break a skill into the steps that are involved. And so it could be as simple as the previous slide where maybe there's just 4 steps, or maybe it's as complex as 15 steps. Don't make it more complicated than it needs to be. If your child is doing well with something with less steps, you don't need to have 15, but this is just to show that sometimes if there is a breakdown or you're getting stuck on one particular step, that you can kind of expand and see maybe there are several steps in that one step that maybe need a little bit more teaching. So we spoke about some strategies from more of the skill building perspective, and now we'll look at some strategies that are more around managing that disruptive behavior. And so Shannon had spoken about this, but maybe looking at the seating arrangement. So if you've got a child that likes to get up from the table and run around or leave the table, maybe you make it a little bit more effortful for them to do that. And so maybe they're, between two siblings, or they're sort of at the back, close to a corner where it's harder for them to get out. It's a little bit more effort and energy to get up from the table. Bite versus whole meal presentation. So not only is it not as daunting for a child to see a small bite versus a whole plate. But it's also, if you think of yourself and the cleanup after, it's probably easier to clean up a little piece of Brussels sprout than it is a whole plate that's sort of chucked across the room. So think of it from both perspectives, but also keeping in mind that it is very daunting for a child to see a whole plate of food. Even if you say, all you need to do is take one bite of salmon, they see this whole plate and it's way too overwhelming for them. Minimizing attention for problem behaviors. So again, just maybe doing a little bit of reflecting or a little bit of observation to see, when am I engaging the most with my child during mealtime? Is it when they are, they're sitting there refusing to eat? Am I sitting there kind of coaxing and coaching, which is very natural for parents to do? Or maybe I'm getting frustrated, or, there's a lot of sort of one-on-one attention being given to those problem behaviors versus when they're sitting and eating appropriately, and you sort of think, okay, I don't want to interrupt, I don't want to bother them, everything's good, don't rock the boat. But maybe they do need that attention, because from their perspective, you are their whole world in those moments where it's just you guys engaging. And so maybe there does need to be a little bit more checking in and attention given to when they are sitting there eating appropriately. When it comes to food expulsion, so those are the children that there's lots of gagging and vomiting, imitation and modeling can be really powerful. And so this picture is great because it shows the sibling being the model for the family, and sort of showing, sometimes we'll take a bite, we'll do some really exaggerated chewing, and then we'll open our mouth to show it's all clear. So also, gradually increasing the bite size. So if there is a lot of sensory or oral motor difficulties, and that's why the gagging or vomiting has happened, then making sure that we're starting really small where there's success and increasing from there. Minimizing attention but maintaining safety. And again, this is something that I've experienced too, where sometimes I give really big animated reactions when my daughter accidentally gags herself with a spoon, and so she thinks it's sort of funny and she'll do it again. So I really have to be mindful of my own big reactions and see, can I sort of give her those big reactions to appropriate eating versus when she's sort of being silly with her utensils. When it comes to self-feeding, so that's where those task analyses and chaining can be really effective. Also, maybe looking at what is the expectation for your child to feed themselves. And so maybe you say, babe, you feed yourself for 2 minutes and then mommy will help you with the rest. So that they're really clear on what the expectation is, and then they know that there is an end and that they don't have to do this the whole time by themselves, and maybe it's a little less daunting. And then when it comes to snacks and meal times, using those as all opportunities to practice this skill of self-feeding, while also keeping in mind, we don't want to make it aversive and for the expectation to be so unmanageable, but to treat every opportunity that they're eating as a opportunity to practice self-feeding. When it comes to food selectivity, that's when we can use, that first then strategy to help sort of engage with other foods. Maybe it is just that touching or manipulating, or maybe it's taking a bite or a little, a taste of it. Shaping, so Shannon spoke a lot about that, but that food chaining and tolerance and sort of making foods resemble, something that's a little bit different than they're used to or that they're expecting, but slowly. Flavor masking is a huge one. I mean, that's condiments, right? Who doesn't love condiments? So whether it's mayonnaise or ketchup or ranch, that's huge for kind of disguising the flavor of those new foods that they're maybe not so keen on trying. And even if they're just using it as a vessel to get, the dip in their mouth, at least they're engaging with that new, the carrot or whatever it is. They're bringing it to their mouth and there's not that expectation to eat it. And then repeating exposure, just getting your child involved with the cooking process, letting them crack the egg or, be involved in some of the baking or the preparing of food, so that the expectation is not to eat it, but they're exposed to the smells, to the textures, and so that this food is not so foreign when it shows up on their plate. Social narrative can be really effective because it sort of sets up that expectation of what's expected at mealtime. It sort of takes some of the guesswork out and helps to describe a little bit more clearly how a child can behave, what their options are, and it's written in the first person. And then another thing that we've noticed recently that's really effective is just education around healthy eating. For some of our older children, it can be really motivating for them to learn that certain foods make them big and strong, or give them muscles, or give them the ability to run really fast, things like that. So sometimes education around what certain foods can do for our body can be really powerful in helping to expand their food repertoire. So here's an example of a social narrative. So again, it's written in the first person. It's speaking about this little guy. His name's Aiden. He's 5 years old. And it just walks through. It says, eating foods helps me grow. Eating food helps me to be healthy. It's important to eat different foods. Sometimes I may have to taste a food I've not eaten before. This is okay. I might like the new food. I can try one small bite of the new food. If I like it, I can eat more. And so that really tells Aiden, it's speaking in first person. So it's sort of his way of that internal dialogue to say, I'm going to be exposed to foods that maybe I haven't seen before. Here's what I can do. I can try one small bite, and I don't have to eat it if I don't like it. But if I do, I can have a little bit more. Just keeping in mind too that persistent food refusal, or those really severe food selectivities, that they should be closely monitored by a doctor. Of course, in this format, these are just general strategies to support with, feeding challenges, but they shouldn't replace that medical support of a doctor or dietitian if you've got a child that is a really, really selective, has really, really severe food selectivity. Okay, so finally, just some factors for success. So it'll be really important to be really super consistent, keep those expectations really predictable for your child, follow through, say what you mean and mean what you say. So making sure that, you're not making those empty threats where you're saying, we're gonna cancel this, or we're not going here, if you really are gonna go certain places. And likewise, making sure that you're following through with the reinforcement that you promised your child. So if you said, just one bite of broccoli, and now you're gonna get your Smartie, not pushing past that one bite of broccoli, making sure you're staying true to what you've said in terms of your expectation. Making sure your goal is really meaningful for your family, and so reflecting on what's important for your family and for your child, and making sure that that's your goal that you're working on. Data, identify what works and spend your time on that. Make sure you're reflecting back and seeing, are these strategies working? Have I given it enough time, or maybe do I need to change things up? And then when it comes to reinforcement, making sure that mealtime rewards are special for meal times. And so maybe the reinforcement isn't the iPad, because your child might get iPad time at other times of the day. That's your 15 minutes to do the dishes, or have a few minutes to yourself. So maybe it's a specific app on the iPad, but making sure that you're really reserving certain rewards for mealtime so that they're really powerful and that your child is more motivated to work for them in response to some of those behaviors you're expecting.